Hi, my name is Catherine Kravitz-Carr. I'm the chair of the Government Affairs Committee with the American College of Nurse Midwives, and I'm here to talk to you about August being Advocacy Month for midwives. Congress is out of session in August, which means that it's one of the most important times for midwives to think about how we can advance legislation that helps improve maternity outcomes in the United States and opens doors for midwifery. When you talk with your representatives, they can co-sponsor H.R. 2141, which is the Maximizing Optimal Maternity Services Act for the 21st century, H.R. 2141. The bill is introduced in the House of Representatives, so your representative can co-sponsor it, and that is that they put their name on the bill in a gesture of support. A senator cannot co-sponsor per se because this is not a Senate bill. However, they can still learn about the bill, and it's still, when you speak with them, it's an opportunity for them to understand the impact that the bill would have on access to maternity care in the United States. Ready to make your 3 5-minute phone calls. This is how it will go. You go to the website of the American College of Nurse Midwives for Advocacy Month. You'll click on the button, Take Action. It will take you immediately to the CapWiz page, and there you can enter your personal address, and it will give you complete information on your representatives and your senators in Congress. Their information will also come up as far as their phone numbers.
I've got myself set up. I'm looking at my script. I've reviewed my Moms for the 21st Century information, and now I'm going to start my call. And afterwards, it's a great idea to write a follow-up email, and that does take a few minutes. We have a template on the website for you to use. All right, I'm ready to call. I'm going to call Kate in my representative's office. Hi there, this is Catherine Kravitz-Carr. I'm calling with the American College of Nurse Midwives for Kate, the Health LA, please. Oh, great, she's there. Thanks so much. Hi there, Kate. This is Catherine Kravitz-Carr. Yeah, we've spoken in the past. Midwife from Cambridge. How are you? I am calling because it's August and the congressional recess is upon us, and I'd like to invite you and the representative to visit a midwifery practice in the 8th District during the recess, or we could set up a meeting in the Cambridge office if it's not possible. Okay, you need that letter sent? Okay, great. So I actually have a letter that I've written. It's available on the website. You can use it as a template. This particular office needs the letter faxed. Your office may need it emailed, or they may not even need a letter at all. So, Kate, I'd like to discuss how midwives can improve the state of maternity care in the Commonwealth. Specifically, I'd like to just let you know ways that midwives can improve maternity outcomes by encouraging best practices and saving healthcare dollars. Despite higher childbirth costs in the United States when compared to other industrialized countries, we rank far behind on perinatal outcomes, and there are striking disparities in communities of color. Hospital maternity care is Medicaid's most costly expense, and midwifery care results in fewer C-section births than physician care for equally low-risk women. The average costs for a vaginal birth are about 50% lower than those for a cesarean birth, and every 1,000 women who avoid unnecessary cesarean sections amounts to over $7 million in healthcare cost savings. More cost savings can be incurred during the pregnancy of midwifery patients because 9% fewer women in collaborative care than in physician-only care make the costly visits to emergency rooms. One of the reasons this is so important is that nationally and statewide there is a shortage of obstetricians and gynecologists, which make it even more important that women in Massachusetts have access to midwifery care and that we continue to grow the midwifery workforce. Midwives do provide gynecologic care, including pap smears, primary care services, and annual exams to women of all ages. And we do see women in pregnancy and through their births. So I'd like to tell you about H.R. 2141, which is the Maximizing Optimal Maternity Services for the 21st Century Act of 2011, Moms for the 21st Century. It was introduced by Representative Lucille Roybal-Allard in California in the House of Representatives, and it will enable Congress to support best maternity practices and the education of a more diverse maternity workforce. Let me send you some links. I have a fast fact sheet on midwifery that highlights the quality and lower costs of midwifery care because we don't use as many costly interventions. And it does also discuss our good outcomes and lower cesarean section rates with a number of different studies that are cited. Yep, I'll send that to you in an email. Let me have your email address. Great. Got it. We'd love to have the representative co-sponsor HR 2141. So you'll talk with him about the bill and let me know how he responds next week to see if he'd be willing to co-sponsor. So if I haven't heard from you in about a week, I'll give you a call back about the representative's response to co-sponsoring and if we can set that meeting up. Please do keep in mind that you can use me as a resource if you have any questions about women's health care and the role of midwives. All right, we'll be in touch. Thanks so much. So now I'm going to get my email ready and send that off to Kate, and then I'll call my other 2 offices and I'll follow up with them next week if I don't hear from them. Do look at the website for different ways that you can participate in Advocacy Month. We'd like to make this a big splash of midwifery information on Capitol Hill. Let people hear the voices of midwives, hear about what we do, how we serve women, how we improve outcomes, how we save costs. And you can help us make that happen by participating in Advocacy Month in the best ways that you can. Please do give us a call at the national office. You can email gac@acnm.org if you have questions, and do feel free to call. We encourage you to participate even after Advocacy Month is finished during Midwifery Week. If you can let your legislator know that you're thinking of them and wish them a happy Midwifery Week, make sure they don't have any questions. Certainly put them on your holiday card list and then contact them again in the spring for Virtual Lobby Week. Thank you so much for educating Capitol Hill about the benefits of midwifery and for participating in Advocacy Month.